It's estimated that 50% of the homes and buildings in the U.S., at least 50%, have water damage. Wow. Now, you don't have to necessarily have water damage to have mold growth, because if you look at, new construction, a lot of the times the construction crew puts up a frame and they might not get back to that house for 3 weeks. And in the meantime, it rains on it. And so you already have materials that are conducive to overgrowth. And it's one of those things where, when people hear mold, they think black mold, which is Stachybotrys. And that one is certainly dangerous. But there are many species you can't see or smell, which are just as harmful. Right. And so, I have worked with couples and individuals who are multimillionaires. And, it has nothing to do with the hygiene of your home. Right. It has to do with, humidity, structural issues, things of that nature. And so.
And our homes are locked up tight now. We want these high energy efficient homes, and we're locking them up tight and not allowing the house to breathe. So I would suspect that the mold toxicity is pretty high.
Yeah. And, what people need to understand is that mold behaves differently indoors than it does outdoors.
Sure.
So when there was not such a push for energy efficiency, there was a better exchange of indoor and outdoor air. But now, you may only have a small amount of mold inside a house, but it can become problematic very quickly. And patients will say, well, oh, Dr. Tim, I went to the Amazon and, there's all this mold there. Why didn't I have a problem? Because mold behaves differently outdoors. And it's just like in the gut, you need certain species to keep other species in check. Right. And when you don't have that, that's when things become problematic. So
yeah, sorry. Tell us what would be some symptoms that if somebody, suspects that, hey, maybe it's a problem for me, I don't know, what kind of things would they be experiencing?
So it can manifest differently, and that's, the main take-home point. So if I've worked with families before where the husband has a certain number of symptoms, the wife has completely different symptoms, the son has even different symptoms, and the daughter has different symptoms. Right. Now, some of the most common symptoms that you see over and over again are severe insomnia, like recalcitrant insomnia that just won't respond to supplementation of any kind and even medication of any kind.
Okay.
And that's because of the inflammation, the neurological inflammation it causes.
Okay.
Also brain fog. And, I worked with an actress who's fairly well known. And, she said it took her almost a pot of coffee to get going. And, she hadn't really been a heavy coffee drinker prior to that. And I said, well, you're trying to overcome the mold, to help your mitochondria produce energy. And so, people can present with recalcitrant insomnia, runny nose, sinus headaches, or what they perceive to be sinus problems. But 95% of sinus problems or sinus infections are due to mold.
Really?
And I learned that from an ENT, yeah.
So if you suffer from allergies, it might not necessarily be that you've got seasonal allergies. You might be suffering from mold.
Yeah. And, to that point, I would say you can have mold toxicity where you have a buildup of mold in your body, but you can also have an allergy to mold where you react to it, or you can have both. But, the mold toxicity part for me is more serious than the mold allergy.
Got it. And so is there tests that somebody can take and to find out, is this even something that I'm dealing with?
Yeah. So there are urine mycotoxin tests, and depending on, which lab you use, they might test for 9 or 10 mycotoxins. Mm-hmm. Some might check up to 20 or 25. But when we get those results back, I might say, Amy, okay, your levels are elevated, but I can't tell you what percentage of these mycotoxins came from your house, from the grocery store, from the mall. And all I can tell you is that your body burden is pretty high.
Gotcha.
And so sometimes I do that test. Other times I use an organic acids test, and you can look for certain markers on there. And because that gives you a window into many different areas of the body, I like to use that versus, the mycotoxin test is only going to tell us about mycotoxin.